Okay, today is March 20th, 2012. We're here with Valerie, and Valerie is here because she has highly degenerating knees. Her medial compartments on both knees are just about wiped out, and her orthopedic surgeon is talking to her now about joint replacement. Is that correct?
That's correct.
Valerie, on a scale of 10, how do you rate your pain 24/7?
I rate my pain from 9 to 10 all of the time. I have a few moments, if I'm particularly, sedentary the day before, which means I don't do a lot of moving. The next morning I have a couple hours where I feel like I can walk in my office where I work and stand up straight and kind of feel like a normal person. But that's very erratic.
And what have you done for the pain? Has he given you drugs?
I have 800 milligrams of ibuprofen, and I have a little bit of Vicodin, but I just quit taking that.
All right, I'm going to tell you, and I want the viewer to know, that these drugs are called NSAID drugs, non-steroidal anti-inflammatory drugs, and they might reduce your pain today, but they destroy your cartilage tomorrow. Did you know that?
I didn't know about the cartilage. I knew that they aren't good for you, and
They're very dangerous, in fact. Okay, Valerie, can I see you get up, please, and walk out the door? Okay, come on back. Your walking is very guarded, am I correct?
Oh, yes.
Okay, and you can sit down again. And are you in pain as you took those steps?
Very low level for me would be, and it's around a 6.
Okay, that would be a low level for you.
That's a very low level.
Okay, because ordinarily it'd be a lot more.
Ordinarily, it's a lot more.
Okay, thank you. Now we get to view your knee, and could you please bend your right knee as far as you can? Bend it all the way as far as you can. Okay, that's limited. Now let's see you bend the other knee, please. Okay, some limitation there too. Thank you. All right, Valerie, we just got done your treatment. Can you walk out here, please?
My balance is better.
Say that again, please.
My balance is better than it's been in a long time.
Okay.
I'm very excited about that.
All right, and are you walking easier?
Yes. I'm able to bend my knees, which I tend to walk stiff-legged when they hurt. I try not to bend them very much.
Okay, if you walked in the door here with 10 points on a scale of 10, and 0 is no pain at all, what would you give me?
I would say I would say this is a 5 to what I've been experiencing.
Okay, go ahead and sit down again, please.
Okay. And
Yes.
back in here?
On the table.
On the table.
Yep.
Oh my goodness. I haven't been able to bend down like that in months. Okay.
Well, I like to hear that. All right, slip your shoes off.
Okay.
And let's have you lay back. And I just want to see how far you can bend your knees. Roll your pants up. And you might not be able to bend them real far because there's still a lot of volume in there, but take your right leg, pick your knee up, and bend it as far as you can.
I feel like I can do my little yoga stretch. I haven't done that.
Okay.
Better.
All right, and the other side? All right, that's still got a ways to go, but there's a lot of volume in there,
yes.
Okay? How do your knees feel at this moment?
Well, I feel the volume, but I'm experiencing a relief that I haven't had for a while. And I'm just hoping that it's going to stay.
Okay, I would bet you that the pain, and I don't want to put words in your mouth, the pain level has already dropped below 5.
Oh, it keeps getting better.
It's keeping on getting better.
Yes.
Because the oxygen really kicks in. All right, so let me have you get up again.
Okay. Oh.
I'm having you take another walk out the door. This is your second walk out.
Oh my gosh. My legs can bend.
Say that again just the way you said it.
Oh my gosh, my legs can bend. They haven't been able to bend like this, and with my weight, with standing up, with my weight on them. Oh
Okay.
my goodness. Ah,
All right, this is about a few minutes now after your treatment. What level do you give me now? You went from 10 to a 5.
well, I'd say I'm down to a 4. I'm guarded. Actually, I'm lower than a 4. I just have this fear of it's going to go back to being bad any minute. So I have to get used to feeling a little.
Okay,
Feeling
now
better.
I can understand that concern too. Okay, thanks. Okay, what do you notice now? We're about 10 minutes past treatment.
Well, in just sitting here, I feel better. I feel like I can move my legs. That constant pain is not there.
Okay, can you walk out the door?
I'm hoping I can. Oh my goodness.
Walk fast.
Okay.
Now come on back. I'm impressed.
I have not walked that fast in probably 2 years.
And on a scale of 10, you came in with 10 points of pain. How much pain is in your knees now?
None.
None.
None. I have no pain in my knees. It's such a relief. It's helping me take deeper breaths than I've been able to take, because with pain you guard. There's a guard in there of breathing, even though you know you should breathe deeply.
This is something you would recommend to other people?
Oh my God, yes. I would.
Okay.
I would.
Thanks. Well, your knees are pretty well advanced. I'm not promising you 100% relief in 1 week. Typically, some of this pain will come back. Typically, some of this pain will come back overnight. Not necessarily a lot,
Okay.
but your threshold, the baseline, should be better typically. Okay?
Okay.
All right.